Here in Arizona, there is one new case. The Pima County Health Department announced that there has been a presumptive positive case in southern Arizona. The case is travel related. According to the State Department of Health Services, there have been 2 confirmed coronavirus cases and 3 other presumptive positive cases. 56 people have been tested, and there are 7 tests that are still pending.
Right now, Governor Ducey, as we expected, is giving an update on the coronavirus in Arizona. Let's listen in.
At the state level, we've cleared the deck. COVID-19 is my top priority, my team's top priority, and Dr. Cara Christ's top priority. Dr. Christ and her team of health professionals have been working 24/7 to ensure we're communicating the facts to everyone in our state, the education community, the business community, government officials, and the media. This morning I participated on a video conference call with Vice President Mike Pence, the Secretary of Health and Human Services, Alex Azar, top federal health officials, and the nation's governors. Vice President Pence stressed the importance of being calm and steady in our efforts to protect public health, and that's the approach that we've been taking in Arizona. We will continue to follow the facts, providing all information that we have in a transparent and timely manner. When I know something, you'll know what we know. And we'll be using every tool in our toolbox to reduce community spread and protect public health. Arizona is approved by the Centers for Disease Control to conduct in-house testing right here in this lab. That has allowed us to quickly diagnose and provide treatment. We know that for 80% of people who contract COVID-19, it will be mild. We also know that seniors, especially those with underlying health conditions, are most at risk for serious complications. I want to say that one more time. We also know that seniors, especially those with underlying health conditions, are most at risk for serious complications. To address these factors, we have been communicating with the health professionals and facilities caring for Arizona's elderly population. Moments ago, I met with leaders of these facilities across our state to ensure they are aware of the proper precautions and getting all the support that they need. Department of Health Services will continue to stay in close contact with long-term care professionals and nursing home providers to ensure that the latest information is being shared and all precautions are in place. As part of this effort, DHS will be sending out surveyors to confirm enhanced infection control protocols are in place for vulnerable populations at nursing care facilities and hospitals. I'm going to hand it over now to Dr. Cara Christ to provide additional updates. Director?
Thank you, Governor Ducey, for the introduction and your leadership to ensure the health and safety of our communities. I'm grateful for the partnerships that we have in working with DEMA Deputy Director Wendy Smith-Reeve and community stakeholders, including Dana Kennedy with AARP and Dave Vopel of the Arizona Healthcare Association. My team has been working nonstop in response to COVID-19 and ensure we keep our communities and families safe while having as minimal of an impact on Arizonans' daily lives as possible. Here's the latest information about the spread of COVID-19 in Arizona. To date, we've had 6 cases. 2 of the cases have been confirmed by the Centers for Disease Control and Prevention, and the other 4 are presumptive positive cases tested right here at the Arizona State Public Health Lab. A presumptive positive case has been tested at the lab, but is still pending confirmation from CDC. However, we still take public health action on those results. There are 2 cases in Maricopa County, 3 cases in Pinal County, and 1 case in Pima County that was just recently announced. The 6th case will be updated on our website with our daily data update at 9 a.m. tomorrow. As we announced Sunday, one of the 6 Arizona cases is a member of the American Leadership Academy Ironwood K-12 campus, and state and local public health are actively investigating to identify any close contacts that may have been exposed. Identified individuals will be monitored for fever and respiratory symptoms. The school has proactively implemented public health recommendations, including school notifications and cleaning and disinfection of school grounds. This individual did not have severe illness and is not currently symptomatic. Because the individual was not on campus while ill, public health believes the risk to others outside of close contacts for them getting COVID-19 from this person is low. Public health will provide specific patient information in the event there is a risk to the public. We prioritize a balance of patient protection and ensuring the public is provided information when necessary to protect the public health. There has now been community spread of COVID-19 in Arizona, and we are expecting more cases. While it's impossible to predict how many cases we will have, the number of cases could be similar to a flu season in Arizona. We want to ensure that the people at highest risk for COVID-19 are taking every precaution to stay safe from the disease. Those that are at highest risk are older adults and people with serious medical conditions like heart disease, diabetes, or lung disease. I know this can be very concerning for family members, friends, and loved ones in this high-risk community. My children's grandparents and great-grandparents live in the Valley, and I want to assure everyone that we are doing everything we can to bring awareness on what steps you can take to mitigate the spread. People at high risk should be prepared if an outbreak happens in their community, and we encourage them to have supplies on hand, such as extra prescription medications, over-the-counter medications, and supplies like tissues and other household items and groceries. Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting high-touch areas like your doorknobs, light switches, toilets, faucets, and phones. Stay away from crowds if possible, and have a plan that if you get sick to call your healthcare provider and identify who else can care for you if your caregiver becomes ill. Tragically, there have been 19 deaths in Washington state, and many of the deaths have been in long-term care facilities. There are several steps long-term care facilities can take to help stop the spread of this disease. Our team reviewed these recommendations in an informational session for long-term care facilities last week and met with a number of long-term care facility administrators earlier today. I would like to provide you all with some brief remarks about our recommendations. The first is to limit visitors. We understand long-term care and assisted living facilities are people's homes. Part of our recommendations for infection prevention include balancing good physical health while maintaining mental and emotional health of all residents, which can often be impacted by visitation. Therefore, we recommend that facilities screen all visitors for illness before visiting, post signs at the facility entrance instructing visitors not to visit if they have symptoms of respiratory infection. Consider limiting visits from children, similar to what a lot of facilities do during influenza season, and try to accommodate visitors by phone or video conferencing before allowing them to physically visit. Our second recommendation is about infection control activities within a facility. We recommend facilities prevent the introduction of respiratory germs by educating all staff and residents on the prevention of respiratory viruses, which includes COVID-19. This education includes basic hand washing, respiratory hygiene, and implementation of standard, contact, and droplet precautions. Staff and residents should be up to date on vaccinations, including their seasonal influenza vaccination. And facilities should ensure sick policies allow employees to stay home if they have symptoms of a respiratory infection. Facilities should also assess resident symptoms of respiratory infection upon admission to the facility and implement appropriate infection prevention practices for incoming symptomatic residents. For those residents who are sick with respiratory illness, we recommend that workers take precaution when entering a resident's room. So facilities should post signs on the door or wall outside of the room that clearly describe the type of precautions needed and required in order to protect that resident and themselves. Make personal protective equipment, including face masks, eye protection, gowns, and gloves immediately available outside of the resident room. And position a trash can near the exit inside any resident room to make it easy for staff to discard personal protective equipment and other materials. Residents experiencing respiratory illness should have a designated dining area apart from a dining area for the well residents. And if sick individuals must leave their room, we ask that facilities make sure they wear a face mask. Finally, we recommend that facilities identify dedicated employees to care for sick residents. These employees should only care for sick residents and not also for well residents. What can the public do to help protect this very vulnerable group? To stop the spread of COVID-19 and ensure our loved ones in long-term care and assisted living facilities are safe, there are also things we are going to request. Take precautions similar to those that we recommend for the prevention of other diseases. The best way to prevent the spread of respiratory illness is to wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue and then immediately throw the tissue in the trash. Clean and disinfect frequently touched surfaces and objects. And if you need to see a healthcare provider, consider telemedicine as an option. I urge everyone to find reputable sources for information about COVID-19, and please don't spread inaccurate information. The public health departments are great resources and will continue to provide factual, up-to-date information. You can always find the most up-to-date information on our website at azhealth.gov/COVID. And you can contact your local public health department, such as the Maricopa County Department of Public Health or Pima County Health Department. We have a link on our website that will link you to your local county health department. cdc.gov is another resource for up-to-date information. Again, I want to assure everyone that the public health system in Arizona is well prepared to respond to the spread of COVID-19 in Arizona. We will continue to provide the public with the most up-to-date information and advice on how to keep yourself and your loved ones safe. We will now have time for a few questions.
Let's start with Bob.
Okay, you've been listening to Dr. Cara Christ, who is the point person for the Arizona Department of Health Services, talking about the state response to the outbreak and the spread of COVID-19. We have had cases here in Arizona, and they really put a spotlight on our elderly population, because our elderly population, we know that we have so many residents here who have retired, come out here to enjoy their twilight years, who are especially vulnerable to COVID-19. So the governor made a point of talking to that group of people, and they had special instructions for the elderly population, always most at risk for this.
Right, and obviously because of a weakened immune system as well, that's why they are very susceptible to getting COVID-19. Also, seniors with underlying conditions, of course, that they are most at risk. What was interesting is Dr. Christ really highlighting extra precautions that are going to be made at a lot of the assisted living facilities.
Which is where we saw the deaths in Washington State.
Exactly. Specifically, 19 people have died in Washington State. All of them were seniors. But in talking about these assisted living facilities, you know, they want to start to try to limit some visitors. Also screen these visitors, make sure there's not any respiratory illnesses, kind of limit the children who go to these facilities. So really they're targeting this, and they're kind of like treating this like the flu, really.
Yeah, and at this point, I mean, that is a good way to approach this. The basic common sense approaches. Wash your hands as often as you think you need to, which is, in the world we're living in right now with COVID-19, pretty often. Has to be at least a 20-second hand wash, not just running it under the water. 20 seconds, warm water and soap. And if you don't have access to soap and water, which is the preferred method of cleaning your hands, then you go for the hand sanitizer.